We're good to go. Hello, everybody. Thank you for being here. I'm Setayesh Yazdani. I'm a junior fellow at Massey College and a third-year Doctor of Pharmacy student. Today, I'll be hosting this panel session. Very excited. We have interesting discussions coming up, and I'll be introducing our guests shortly. So this, as you have read the program, this session is focused on academic experiences. And what we're going to be doing as part of the session is the academics who are sitting here, they have experience working with public policy, the policy world, and we're going to be asking them a series of questions to discover their challenges, their path, and any lessons learned. So I'm going to take a few minutes now introducing our panelists. I'm going to start with Dr. Mina Tadrous. Mina has been a mentor and professor to me, so I'm really grateful that you took the time to come here today. Professor Tadrous is a pharmacist and a pharmacoepidemiologist and Canada Research Chair in Real-World Evidence and Pharmaceutical Policy. He has developed an impactful research program that has helped change drug policies in Ontario and nationally. Professor Tadrous has also research appointments at Women's College Hospital, Institute for Clinical Evaluative Sciences. He has served as co-director of the Ontario Drug Policy Research Network, influencing policies related to dozens of drugs, including opioids, naloxone, and hepatitis treatments. He co-chaired the national working group convened by the Canadian Agency for Drugs and Technologies in Health, CADIS, and Health Canada that developed guidance on how real-world evidence can be used in regulatory and reimbursement decision-making, and he's leading the charge on developing means to help tackle drug shortages in Canada. So thank you for being here. Now I would like to introduce our second guest, Dr. Carolyn Tuohy. Thank you so much for being here. Dr. Tuohy is a highly regarded scholar in comparative public policy, particularly social policy in advanced industrial nations. She has authored, co-authored, and edited 8 books, numerous journal articles, and book chapters on health and social policy, including patterns of policy change, medical politics, professional self-regulation, long-term care, regulation of occupational health hazards, and comparative approaches in public policy. And her most recent books is Remaking Policy, Scale, Pace, and Political Strategy in Healthcare Reform. She's currently working on a book on the power of narrative discourse in public policy. Dr. Tuohy held a number of senior roles at the University of Toronto from 1992 to 2005, including Deputy Provost and Vice President, Government and Institutional Relations. Professor Tuohy's impact on public policy awards was created on the occasion of Tuohy's departure from her role as Vice President, Government and Institutional Relations. She's frequently consulted by government and related agencies on public policy matters, and she's a senior fellow at Massey College. We're very grateful to have you today in our discussion. It's also a pleasure to introduce Dr. George Fallis. Dr. Fallis is a retired university professor, and he was a professor in economics and social sciences at York University. Dr. Fallis was also the Dean of Faculty of Arts for 7 years at York. He holds a PhD in economics from Princeton University, and his research interests are in the field of urban and housing economics, public policy, and higher education. His current research focuses on universities and their roles in democratic post-industrial societies, Canadian higher education policy, the growth and evolution of the welfare state, and income inequalities in Canadian housing policy. So thank you for being here. I think by just the way of introducing them, we can see that we have diverse experiences in the room, so we're very excited to hear from you. So I'm going to start by asking the first question, and I'm always interested in knowing why, the why behind your work. So I'll start with Dr. Tadrous. What motivated you to engage in public policy alongside your academic career, and how has this engagement enhanced your research and academic objectives?
Absolutely. Thank you very much, and thanks for having me. Always strange to hear your bio. I still, I think for me as a clinician, like I started as a clinician, and when I first got into research, I was obsessed with the idea of producing a study that can impact many, many lives. You know, as a clinician, you kind of always work through daily and you hope that you can improve people's health, improve their lives in some way. And I remember sitting in a basement in Memphis, Tennessee, working as a hospital pharmacist. And this paper came out of Canada, where I grew up. And so I show up at the hospital that morning. It was a Saturday morning, and they're switching all the patients from one drug to another. And I'm like, what is going on here? Like hundreds of patients. And they're like, well, this paper out of Canada that used big data showed that there might be a drug interaction here that we never thought about. And I was like, holy moly. Like, you can do one paper that impacts millions of people around the world. And that became kind of my North Star. And then in doing so, as I dived into it and I did my PhD work, it's hard to hit those papers. And then what I realized is that there was a really big hurdle that was left sometimes when you produce these kind of work, which is that a lot of the way that we paid for drugs, the way that we used medications and the healthcare delivery was so hinged on policies and regulations and policymakers that it became essential for me to like communicate and translate that information to them. And so during my PhD, I quickly realized that probably 6 people were going to read my PhD, my committee and my mom. And I was okay with that. But I realized very quickly when I started doing policy work early in my career that I could have another 6 people read it who would be policymakers, but that can have the same impact that I wanted at the very beginning of my career, which is to affect thousands, if not hundreds of thousands of lives and make it better by making sure that the right evidence gets into the right hands to make the best policies.
Okay. Thank you for that. And Dr. Tuohy, what's the why behind your work and engaging with public policy alongside your academic work?
Well, I actually study public policy, so there is kind of a natural inclination, or at least you might think there's a natural inclination. But not everyone who studies public policy actually gets involved in the policy process. I actually happened to choose, and it was accidental in a sense, happened to choose an area to begin with in my study of public policy, health policy, which was of burning interest at the time to governments around the world. I won't tell you exactly the decade, but it was a few decades ago. And so I kept getting invited into the policy process because I was studying this really hot policy issue. Now, I didn't choose it because it was hot. I didn't choose it because I wanted to get involved in public policy, although I didn't resist getting involved. I chose it because it was of real theoretical interest to me. At the time, I was working within an area of political science that I've more or less continued with, that looks at competing bases of power. And that is, what is the fundamental resource on which your power is based and that you can deploy in the policy process? And I was looking at 3 distinct and fundamental bases of power: the authority of influence, the authority of the state, wealth, and skill or knowledge. What better arena in which to study the competition amongst these bases of power than healthcare, which had been heavily privately financed, was populated by skilled and knowledgeable professionals, and in which the state had an increasing interest. So it was purely that theoretical reason that led me to study health policy, and yet it set me on a route of fairly regular involvement with the policy process in various ways. And there are, we'll probably get into this, but there are different channels that are more or less direct by which academics influence the policy process. And I've been involved, I've been engaged in a number of those areas over time, but always by invitation. So I haven't deliberately attempted to engage in the policy process unless invited. I've just been fortunate to be invited.
Thank you. And I see a parallel between your work and Dr. Tadrous, so that would be interesting in other questions that we'll get to. Dr. Fallis, what was the why behind your work?
I guess when we talk about these whys, you always go to your family background first. I came out of a family of sort of left central United Church. And, you know, the big problem were the Anglicans that controlled the city. We were you know, left center United Church. And the view of growing up was that you should think about trying to make the world a better place. That was sort of a kind of orientation. But none of my family had been in government. None of my family had been in business. It was all teachers, doctors, lawyers. And interestingly, I love to say this in academic circles, all 4 of my grandparents had university degrees, largely through teaching and so on, and the ministry and so on. So I came to U of T. My field is economics, and you've heard it disparaged earlier today about this very abstract thing that no one in public policy really wants to study anyway. But I actually came here to U of T, where public policy, or economics, you couldn't study economics on its own. It was the Department of Political Science and Economics, so you had to study the two together. And you had to study economic history, and you had to study the history of economic thought. So this kind of natural process of bringing together economics and policy was rooted in the U of T economics department. Oxford is the university most associated with this tradition, called the PP&E tradition, where you study politics, philosophy, and economics. And the philosophy is very much partly about moral philosophy. So apropos of the discussion this morning about the role of morality, it was embedded in that tradition. So I sort of got on that, and I did public finance, and there in public finance, you're talking about the role of government. So there's a whole field of your discipline about the role of government. And my orientation was to social science, not natural science, but I like to think theoretically and use a lot of data, so that was a kind of natural way to go about it. So I head off to Princeton and said, I'd like to do a PhD in economics, but you have a wonderful public policy school here, the Woodrow Wilson School. I'd like to do some of my courses there. They looked at me like I wanted to do Chinese scroll painting. You do not go over to a public policy school if you're going to be a good economist. But I was lucky enough to have an advisor who was opening up the field of urban economics, and I started out in urban economics. And then when I graduated, I said, I would like to go and work in government before I come to academia. So I went to work in the Ministry of State for Urban Affairs and then the Ontario Economic Council before I got my position at York. And later on we'll talk about these avenues, but I think both of those hold interesting models for how academic work can contribute to the public policy process.
Okay, thank you everybody. Thank you for that overview. I'm sure everybody's interested to learn about specific examples of your work and how that affected public policy. So Dr. Tadrous, I'm going to start with you again. If you can share with us specific example or examples from your career where your academic work directly influenced policy decisions and implementation. And there's a second part, what were the key factors that contributed to the success of that engagement?
Absolutely. So for me, I think the work that we do, and we kind of in the bio talked about the Ontario Drug Policy Research Network, and the unique setup that I have, that I'm very blessed to have, is that as a co-director of the ODPRN, which is kind of where I started my career halfway through my PhD and have kind of grown up in that space, is that we're actually funded by the Ministry of Health to be their ad hoc research arm. And so the way that we view ourselves in that group is that we are the rapid response consultants from an academic lens. And what that really opens up to us is that we had to kind of face ourselves and face what it means to be an academic and think about how do we respond to things in a very timely fashion that is not normal for us academics. And so I think there's this kind of built-in process that's allowed us to be able to answer a lot of these questions. And so I can paint you a picture of the kind of examples we get. We often will get a question around, there's a policy that they're thinking about in shifting the way that they pay for a drug. And so they want to know how many people are going to be impacted by this, because that's obviously a very important issue, and what would the models look like. And so what we're able to do is tap into data from across Canada. And so a really great example of this is that they were exploring the use of testosterone. So At the time, testosterone was only available as an oral or an injectable agent, and the pharmaceutical companies had these new really great topical products that they were going around touting to everybody. They were telling men, are you feeling a little tired? Gained a little more weight than you'd like. You might have something called low T. They kind of made it up, but it really worked well because the sales went through the roof. But the problem is that if you don't actually need it and you don't do the proper blood tests, you increase your cardiovascular risk with no benefit. And so we were really concerned with what was actually happening in that space. And so we were able to look at different provinces' listing strategies and then show up to the, to the ministry and say, if you copied British Columbia, Alberta, who all had different strategies at the time, this is what you would impact. We would scale and say, your policy, if you became way more restricted, so British Columbia had the most restrictive process, you would impact 7,000 lives, for example, and you would save $5 million, but you would have way less use. And so by giving them a menu of options using data, it kind of fits their need, which is that they don't want us to show up and be like, you should do this. It was, here's the information, and you kind of leave it at that point. And so it's kind of an example of how we work, that we try to answer and give them data that helps inform their policies rather than telling them that what best thing that they should be doing.
Right. And I think you answered the first part, right, as giving us an example. I mean, if you want to tap into that example again, but what factors influence how successful this process is? Like you working as an academic with policymakers, what makes this work successful, this collaboration? Yeah,
the core of it all is relationships, right? There has to be a sort of, we meet with them bi-monthly, we know their pressure points, we understand the things that they're dealing with, we have a sense of expertise, they understand that we understand what's going on. And so I think for us, the type of policy work that we do is also adaptive to the way that they work. So one of the challenges in academia is that we're told to like pick an area and dive into it really deeply. But if you're in the drug programs, for example, if I, for example, like, in my PhD work, I concentrated on one drug class. I looked at osteoporosis medications and I dived in really deep. If I went to the policymakers and said, hey, when you're studying osteoporosis drugs, come to me. They are never going to come to me. And the reason is because that portfolio, that person who works in the drug program has to deal with thousands of drugs. So they want someone who's able to answer thousands of potential questions. And so having that relationship and showing that we're nimble, responsive, have the expertise to answer that, but also understand how their projects work has been crucial. And that's how we built it. But really the core of it all is building those relationships to be able to work directly with them.
Thank you. A lot to come back there, but I'm going to ask Dr. Tuohy now. If you can give our audience an example of your work and how it had an impact in public policy and what factors were involved to make it a success.
I'll give two, primarily
Sure.
one because it's the most academically based. And it's rather ironic because the example I'm going to give is some work that I did that was very influential in the passage of the Canada Health Act in 1984. Prior to the Canada Health Act, there had been an increasing rate of opting out among physicians. That is, they could opt out of the government plan and bill their patients directly for really whatever they chose to charge and the patient was willing to pay, as opposed to following the schedule under the government plan and receiving payment from government. This affected a minority of physicians, but it was a growing political issue. And the then Ontario Economic Council, remember that, Ontario Economic Council funded this study of opted out physicians. It was a really deep study. We were able to access the practice information through an agreement with the Ministry of Health, the practice information of the physicians, and we interviewed the physicians themselves, and we had, I won't go into it, but a very clever way of anonymizing the linkage of the interview data and the practice data. So what we found in this study was that in practice terms, there was essentially no difference between opted in and opted out physicians. The patients were not getting more time with their physicians. They were not getting a different mix of services. It was all about price. Now, there were some marginal exceptions to that, and we made that clear, but basically the message was, this is of benefit to physicians who wish to charge more, but there's no clear gain to the public. So, but to remedy that situation, we suggested a number of policy options. Some of them were more incremental in just affecting certain groups of physicians where the issue was concentrated, and ranging right up to a full ban on extra billing. So it was picked up, so that was published in 1980. It led ultimately to the Canada Health Act in 1984. Why, and it had the effect of reinforcing, not placing, but reinforcing the position of the issue on the political agenda. It did not have a lot of impact on the actual design of the policy that was ultimately adopted by the federal government, which was essentially a ban on extra billing and a penalty for provinces that would allow extra billing by physicians. Kind of skipping over the more incremental and marginal approaches that we had also suggested could be considered. Now, why did it have that effect? First of all, the window of opportunity was open. This was an issue that had been highlighted by both the federal Liberals, well, and a number of provincial parties as well, the federal Liberals and the federal NDP. The window was open. There was a very receptive health minister, but the root of influence was entirely indirect. I was not, nor was my co-author invited to discuss with government officials the results of our study. Interestingly, we were invited by the Canadian Medical Association. So not only did this play into the broader window of opportunity in a partisan sense, it was supportive of the partisan agendas of the government of the day, but it fit into the micropolitics of medicine in that some specialties were affected and others were not. And we demonstrated that. We demonstrated that more clearly than had been demonstrated. So we actually had some support within medicine as well as within government, believe it or not. So it was that unique set of political conditions that I think enabled it to have the impact, because we were simply, at that point, academics doing their academic thing, and were not directly connected into the policy process. I will make one other point, and sorry to go on, but I mentioned the Ontario Economic Council, and I said, please remember that. In the last session, we were talking about royal commissions and having more or less fallen out of favor. What has really fallen out of favor are these arm's length standing commissions, like the Ontario Economic Council, like the Law Reform Commission, that were continuing bodies, that were conduits from the academic community to government. I, for one, mourn the passing of that model. I think it was a really important connector, but they have proved to be very politically vulnerable to changes in government.
So Dr. Tuohy, just so that I understand, and I'm not sure if everybody in the audience also understands, these bodies that you're talking are in between academics and policymakers? I understand. And this has fallen out of favor, so saying that right now academics work directly with policymakers.
Well, there are some conduits. If the Institute for Research on Public Policy, for example, works also with governments as well as with academics. So but it's hard to identify. Well, there are no direct analogies to these standing councils that used to populate the landscape.
Before going to Dr. Fallis, and I'm curious, Dr. Tadrous, do you have the similar model in your work? Do you work with agencies in between? Or as an academic in your area, do you work directly with policymakers?
So we're tapped in directly with the
Okay.
policymakers in some of the work that we do, but there are certain tables that sometimes they'll put together, but they have become less and less common. I think we saw them pop up during the pandemic, the science table, and you're absolutely right. Like, it was a political target, right? And I think there was a lot of pressure on them for a variety of different ways, and so many of us tried to like orbit it, but not really.
Okay.
And but like, you know, for the work that we do, to directly answer your question, we're fortunate enough to be, you know, we meet with the different, the specific groups that would leverage the work that we do, because we're very applied in the questions and portfolios that we're helping and supporting.
Okay.
So,
Thank you for that. That was very informative. And
Yeah, before we get to
Yes.
sort of an example of success, I just want to add something on the Ontario Economic Council. I joined the Ontario Economic Council when it was being set up. It had been a sort of a moribund institution, and a fairly senior civil servant from Ottawa, Colin Hindle, had come down to head it up. And he developed, I thought, what was a brilliant model. There was about a half dozen of us, and we were each given a policy area. I think Morris Barrett was probably the one overseeing it. And we weren't told what policies to look at. Mine was housing. But we sort of looked out at the public policy domain and tried to identify what we thought was a very important issue for the time. But to me, the other interesting thing was the nature of the contract got right at the heart of incentives between the government and the academe. I used to say the contract would be for about $20,000 for probably 2 years, 2.5 years work by the academic. So that was a big commitment, very low pay compared to other consulting jobs. But academics are always, if you give an academic $20,000, they'll spend some good time on your work. But we said to ourselves, what is it that the government wants? We said, first, it wants a good survey of the literature. So the book that got produced by these academics was a good survey of the literature. That was probably 60% of the work. Another 20% of the work was directed at a very specific public policy problem that we knew was on the mind of the government. So big literature survey, specific analytics, and the last 20% we said to ourselves, we're not going to pay any attention to it, but you can have enough time to write a pure academic paper on this project. Because we knew we couldn't draw in the top people without giving them an opportunity to publish pure academic work. So we got that blend. Anyway, so I think it's a wonderful model, and I too lament its passing. Now, back to
the question.
successes. Well, coming from economics and partly from the department I joined, economics isn't drawn to public policy naturally, but many economists get into consulting, private consulting, and that often causes a big problem in the department because these people who are top flight academics go out and start to make lots and lots of money, but aren't doing top flight academic work anymore. And so there's a lot of tension within economics department to limit the consulting. And I happened to join York when it was overrun by consultants and people weren't doing a lot of academic work. So the notion of getting close to the policy process was not a metric I used in my own work. It was much more, did I contribute to the dialogue? Did I enrich the public policy discourse? Part of it was a feeling that to make the final choice is essentially always a value judgment. And in at least one tradition of economics, particularly around income distribution, we recognize that values matter. One person will have this view of what a just society is, and this person will have quite a different view of what a just society is. And actually, I found some of our discussion this morning about morality a little troubling on that front because I felt it had a presumption that we knew what the moral policy was. If you were referring to Haiti, I would say, I don't know what the moral policy for a Canadian or a Canadian government is with respect to Haiti. I just do not know, given the past failure of Western governments to try to restructure countries. I don't know whether the moral position is not to pull back a little. In any event, so my measure was much more, did I feel comfortable that I was contributing to the public policy debate. Another avenue I've always placed a great deal of influence on, and it'd be very different in your world, Carolyn, is in my courses. And I think that's an avenue that we haven't talked about enough, that in your courses, how do you introduce this? So for example, in my courses, most of my department weren't interested in public policy, but when I taught public finance, I'd make sure that we had a class on the budget that just came out. But that kind of thing doesn't always happen. And whenever you're writing, when I've talked to people about public policy writing, I've said, who's your audience? And I said, I would like it if you could think about how what you write will get on the supplementary reading list of a course. And that's a whole different way to think about how you get into the public policy process. And one of the areas where I think it's hard to do it is that the way referee journals have gone now, they don't value historical coverage or descriptive coverage or institutional coverage. That's not part of your journal article. So I think our students are very deficient in understanding the history of public policy, how our system works, but it's very hard to get readings for them. I've had conversations with many public policy scholars about what is the reading I could give to an economics student to help them understand. But I feel that's another way you can shape public policy without asking yourself, did I influence the outcome?
Thank you for that, Dr. Fallis. And I know you did mention that you did some working in the housing. Do you have examples that you can share with the audience in terms of specifically your work, your academic work impacted policy?
Well, perhaps this would be a counterexample. They mentioned the Ray government getting elected, and the Ray government got elected, and they began to gather these forums to talk about policy. And I got a call from a bright young New Democrat saying, Professor Fallis, we know you've written about housing and written about rent control. We'd like you to join this panel as a spokesman for the developers. And I said, I don't think of myself as a spokesman for the developers. I did do work which showed that rent control significantly reduces maintenance on existing buildings and will have a significant pressure to reduce the supply of purpose-built rental buildings. Something we've seen post-rent control. We don't build purpose-built rental anymore. We build condos, and small entrepreneurs buy the units and rent them. So they said, oh, yes, yes, we like the breadth of your knowledge, but we do need a responsibility to have someone from the developers. So I parted company. I didn't have any influence on that policy, but I do think my work with others did help to contribute to the discussion about rent control, that we have to recognize that whatever its short-term benefits to existing tenants has a significant long-term impact on the supply of housing.
Is that a current problem in Canada?
It certainly is.
I know that's not our topic, but quite
But
interesting.
if you read the papers, one of the big dilemmas in our housing policy is how do we get more purpose-built rental?
Very interesting. Thanks for sharing that. Okay. So you talked about the why and gave us examples. I'm sure there are challenges, and it's not easy as an academic to be involved in this work while you're also managing a lab, maybe have grad students, have roles as professors and teaching courses, developing courses. So starting with you, Dr. Tadrous, again, some of the challenges that you face as an academic in terms of bridging the gap between research and policy, and how can this, the second part, if you can also address, how can these challenges be addressed?
So I think you kind of hinted towards a few. So I think from the traditional academic lens, like one of the biggest challenges for me is that to be an academic who's junior, who's coming up and wanting to get tenure and show that and go through the promotion process, you have to show the traditional lens is like this drilling down and advancement of a specific area of knowledge. And yet, like I highlighted earlier, to work with certain policymakers and certain groups, you had to find a broad ability to answer lots of questions. So in my space, people will pick one drug class in one space, and they'll ask a specific area of questioning that will drive that forward. So to be sort of a broad jack of all trades in this space meant that I had to find a way to make my narrative switch so that my narrative is more about being a responsive pharmacoepidemiologist who works with policymakers. And so that's been a bit of a challenge because it forces me to kind of communicate in a different way to my colleagues who are not used to that, right? They're used to, especially in pharmacy where about 2/3 of the faculty members are labs and they're asking really important questions in a specific area. That becomes a very big challenge to how do you do this kind of work while still meeting your goals for academic endeavors. And within that, people, it's nice to have a narrative around policy impact and the number of policies and policy reports, but our metric is still papers and publication and grants. And sometimes when you go to your peers, if they're not used to the kind of work that you do and it's not applied in the same sense, they'll ask very, sometimes frustrating questions and feedback about your work that you have to translate into that space. And so there's this challenge between how do you make sure that you meet those criteria. And so one of the things we do is we often will conduct a quick analysis or do the analysis that's necessary for the policy that's being assessed, and then we worry about the paper after. And so we kind of have developed this model where we do that, and so we are able to have the policy impact. They continue to have that relationship, but at the same time, we can still have the academic deliverables that we do. And that's been a very big challenge for us. The second thing is in the drug space, I don't know if anyone's been paying, there's a pretty shifting landscape right now. And over the last 10 years, we've seen more of a national play into the space. We've seen the emergence of a pan-Canadian approach to this. Recently the announcement of a new Canadian drug agency and a pharmacare model with the feds finally deciding to play ball in this space. And so, there's how do you stay dynamic and relevant? We've been zoomed in Ontario, but how does that kind of play out into the national space? And so that's, those are probably two big challenges that I'll highlight. There's lots more, but I don't want to take up too much time, but those are kind of two that I think are important for this conversation to be thinking through when you're trying to be an academic that's trying to be relevant in the space.
Okay, so if I grasp it, so it's also keeping the academic rigor, knowing that, you're doing the work, but also being able to respond in a timely manner to the policymakers.
I would not say it's the rigor. I think
Okay.
our work that we give to the policymakers is still we've developed, like the way we keep the rigor is that we develop efficiencies. One thing we do is like a really simple example is that often academics will conduct an analysis and then we'll do like 100 sensitivity analyses. It's not maybe always necessary, right? It's like for us to feel robust and we know what the peer reviewer is going to say and we imagine that reviewer number 2 in our head and we're like, oh, they're going to ask why this assumption did this. And so sometimes we just have to find efficient analyses to be able to answer it in a timely manner. So it's still academically rigorous. I think what it is that we don't have to go through the peer review process, wait to write it up, make sure we go through that. So we conduct these analyses and we give the policymakers exactly what they need. And so I think that's kind of it. It's like we go through that process to make sure that we conduct the analysis for the question being asked rather than the question that's nice to know. So.
Thanks for that. Dr. Tuohy.
Yeah, I really empathize with all of that. I guess one of the challenges, I'll speak at a rather generic level for a moment, is conflicting expectations between academics and policymakers as to what the nature of academic engagement in the policy process is. And on the academic side, I think there's a misunderstanding of the role of what some people have called common sense or ordinary knowledge in the policy process. Now, from the perspective of a rigorous academic entering into the policy process, if you're engaged with other decision makers who are bringing this sort of anecdotal, unsystematic observation of everyday life to the table, you denigrate it. It's not systematic. It's not, the variables haven't been measured and tested. But it is relevant to the policy process. It has a legitimate role in the policy process along with systematic information. And I think too few academics actually appreciate that. I'll give you an example from the US, of which I'm too intimately familiar. The Affordable Care Act, Obamacare, in the US was passed in 2010 under the Obama administration. It was designed by largely academics who knew in exquisite detail how private insurance markets worked and wanted to be sure that they designed a fix for the small group and individual market. And they did. You know, it worked beautifully in economic terms, in theory, but they did not listen to the common sense or ordinary knowledge of what it would actually take to navigate the system that they designed. There's a website, healthcare.gov, which had some initial technical difficulties, shall we say, but once it got up and running, I went on healthcare.gov. I have a PhD. I study health policy. I needed a navigator for healthcare.gov. Now, what about the person who has not been able to deal with private insurance companies and who, you know, needs to have a more efficient and effective route of access? Listening to some ordinary knowledge might have required the academics to sacrifice some of the exquisite perfection of those regulations, but would have been more effective in the long run. So the first challenge is recognizing the importance of ordinary knowledge and the limits of ordinary knowledge, as well as systematic expertise. So perhaps I should stop there, because we have the advantage of a timer in front of us here. So
if there's a second point, I think that's really interesting. So feel free, and then
a second challenge is recognizing windows of opportunity. And I've mentioned that the Canada Health Act example, there was an open window of opportunity. One other example was when I was Vice President Government Relations for the university, and there was an open window of opportunity in the provincial government that was, Dalton McGuinty wanted to reinforce his pitch, basically, as the education minister, and the government wanted to invest in post-secondary education. And I got to be Vice President Government Relations at a moment in time when that was true, and we could actually work with policymakers, and boy did we work with policymakers to, in that case, actually design the system that resulted. But there are not often open windows of opportunity. And so you have to recognize that what you can do is to kind of feed the policy pipeline so that your ideas are there when the next window opens. But don't expect that there's always going to be an open window of opportunity.
so it's kind of luck, but also staying relevant and
Yes.
to the
right,
space.
Yeah.
Just like we kind of take that lens to like what we say is like a top down and then bottom up. I'm sure that the policy people have way better ways to frame this, but on an empirical level, we're trying to answer very small questions for specific policies because we have that relationship. But when we're trying to move larger topics, we know that it's a very long play. So we'll keep publishing papers in the space. Like, for example, like, you know, we've been publishing around biologics and biosimilars and high cost drugs for the last 10 to 15 years. And now, most recently, you've sort of seen a movement in that, but it took a very long time to kind of get them to pay attention versus kind of the micro thing. So you have to do both. And so like both are very important. Yeah, absolutely. Just add to that.
Thank you both for your perspective. Dr. Fallis.
Remind me of the general theme of the question.
Okay, some of the main challenges, like in terms of translating your academic works into public policy or influencing it, and how can this be overcome?
Well, I think certainly from someone in the field of economics, although people probably think that economists have a lot of influence, in most economics departments, your contribution to public policy is not particularly highly valued. It's refereed journal articles. And so if the criteria for promotion are teaching, research, and service, generally your contributions in an economics department to public policy are put under the heading of service, not under the heading of your academic work. So there's kind of a difficulty in bridging that gap, making sure you make enough contribution to the scholarly literature to maintain your academic standing, whether it's for tenure or promotion to full professor, or as well as getting engaged in the policy process. So that's one of the things I think is an ongoing challenge. And I very much vary back and forth about, within the university, do we need to fundamentally change the criteria for tenure in a major research university? I'm of two minds about it. It's very difficult to sort out. And another way to look at it is to say, has the policy world felt that university people are not making a sufficient nuanced contribution to public policy? I'm not so sure. And so that I think the traditions of focusing very much on your pure journal article, academic book work early in your career is probably the appropriate one, and then gradually breadth can enter in and each person can take their own direction. But you know, a lot of people in the academy don't value public policy work, but and economics is somewhere on the edge. Interestingly, there are many in the academy who look at what's going on today and see the reverse as the problem in the academy, that professors have become far too much public policy advocates, particularly out of a sort of a critical research perspective, and that they are no longer scholars but are public policy advocates. So negotiating that dilemma, I think, outside of the public policy schools is pretty central to public policy in universities right now.
In my perspective, and again, I'm a pharmacy student, but I almost think like if there's research being done, if there's funding being channeled to a project or a question, like if it's answering a question that is going to impact a policy or it's going to have a ripple effect in someone's life, at least like in health systems, I think that's valuable. But it's interesting to hear that universities have like, or maybe different scholars have varying perspectives on this issue. So I'm curious in understanding your perspective. Like you went through the process, you know, you worked, you're working as professor, researcher, but also working with public policy. How's that impacted your quality of work? You know, is that harder now to manage? And yeah, and if anybody who's interested in becoming somebody who is like a professor, also doing research, but also engaged in public policy and works with policymakers, how to navigate the path. We can start with you, Dr. Tuohy.
Well, it's a little hard for me to answer that since, as I said, I had the advantage of being invited into the policy process rather than actually having to determine a pathway in. I think that is still often the case, and let me just make a case that maybe the best way that we can do this is to do our very best work within our academic our roles and garner sufficient attention to be then invited into the policy process. Okay. And that has been certainly not just my experience, but the experience of many of my colleagues. Now, you can give it a boost. You can try to get your thinking out there in an op-ed. Some people are way better, including my colleague Mel Kapp, about doing that than I am. But that can be very effective. Working with a think tank that has established connections into government, but really focusing on doing your best policy relevant, if it is, academic work, and getting it out into the public domain. I think we don't pay sufficient attention to the role of the media in the ecosystem that connects academics and policymakers. This was interestingly something that some of my colleagues on the science table pointed out, that it was media attention to the work of the science table that really elevated it within the policy process. And so that engagement with the media is an important part of making that connection.
Right, and I'm aware that Mina, Dr. Tadrous has been on the media because I follow your work. But yeah, so that's interesting. What's your perspective on that?
So it's great, and that top-down approach of like stirring the pot on issues, the media is really the catalyst to that. Like if you want to get change, you should get, for the biosimilar piece, we were working on it for years, and then the Globe picked it up and started doing some of their own investigative journalism into the space and what we were talking about. And it really just opened up a can of worms and really moved the dial on that portfolio. And so it was working with them. The one thing is, if you are developing relationships, it's important to give your colleagues in the policy sphere, especially the bureaucrats, a heads up that things are happening, or you have a paper coming out that's going to have a press release. We've never had any pushback that said, hey, we didn't like that you did this. They understand our independence and our ability to write things, but I think they appreciate the heads up so that they can have a presser ready. Or they know that when that ministry sends and says, like, what are they talking about? Can we, like, I'm going to get asked about this today. So can we make sure that you have questions ready? And so that's the offering. We're like, we're here for you to answer questions on this. My email. Yeah. And we can help them. But yeah, the media is like, that's the best way to kind of make sure that information, like, it is the number one mechanism for knowledge translation, in my opinion.
It's interesting. And I think what I've seen, at least in our space, is that some professors are, they get approached quite often by media, whether it's like news articles or like yourself, for news channels. But like, that's not so common. I don't see that happening quite often.
The media takes relationships, right?
Okay.
And so, for example, like what I don't talk about a lot is that 9 out of 10 times I get approached by the media, I say, no, I'm not the right person for this. And this happened during the pandemic all the time. Like, no one knew what an epidemiologist was before the pandemic. Everyone thought I studied skin, like that. That was kind of like, and I'm like, no, that's the epidermis, and like that's very different. Suddenly, everyone knew. So I would get emails like, "You're an epidemiologist. Talk about this." I'm like, no, I'm a pharmacoepidemiologist. So once we have drugs for this thing, but if you want to talk about disease spread, I have some great colleagues for you. And so, but if I can help them navigate it, because they work on a cycle where they're getting they have a scrum in the morning. They're going to cover a certain topic, and they need something written by the afternoon. So if I can help them navigate that, I become a good friend.
Interesting.
And so 9 out of 10 times, it's not me. And so I help, lead them to the right person who's going to give them the right information. And that's a public service on its own, I think.
I think it has the highest impact because media is consumed by the public who are going to be influenced by those policies. So involving them, letting them know what's happening in the space.
And it leads to, from an academic point, like when you get media attention, it leads to more citations. There's actually good.
Okay, good to know. Dr. Fallis, you have something to add?
Well,
That's all we care about anyway.
I'm an economist, but with a very much orientation toward public policy. So I think there's many ways you can contribute to public policy besides an op-ed and so on. And that one very basic one is giving your students some historical sense of how this public policy domain has evolved. Writing descriptive articles, which are not very in demand in the journals, about the evolution of a particular public policy domain. Putting it on your reading list for students to think about these things. So I think just how you participate in the public policy process is a difficult one for academics to navigate. And I've been doing a fair amount of it recently since I've been retired. But I just want to recount one story. I'd been doing some stuff through the Literary Review of Canada. I don't know how many of you ever look at the Literary Review of Canada. It reviews books, but they invite reviewers who give a kind of longer perspective on the issues, and it almost becomes your own perspective in dialogue with the 2 or 3 books. So I got in touch with the Literary Review of Canada, the new editor, and said I wanted to do a piece, and they got very interested, and so eventually I worked it out, and it was going to be about the role of academics in public policy, and I was using 2 books as a kind of jumping off point, and they eventually said no, and I went back to the editor, and he was back and forth and so on, but he eventually said, I said, come on, I appreciate you have to say no to people, it's not troubling me, just try to give me a sense of why this didn't fit the Literary Review of Canada. And he said, it read too much like a briefing note. And I thought, boy, the penny really dropped there. Here I was thinking I was doing public policy, and he read what I read, which I thought was sort of fairly synoptic and explained the various people who would play in this issue and so on, of the role in academia and public policy, but he saw it as a briefing note. So there's something very different about a briefing note compared to contributing to public policy in the dialogue. So
Okay, so Dr. Fallis, I think what you're getting at is like even the language that we communicate, right, with policymakers is different. Is that what you're pointing at, like academics?
yes, there's all these bridging institutions, and it's sometimes hard to get the language shared, but yes, it's somewhat different, certainly.
Okay.
Somewhat different.
Okay.
Can I selfishly ask a question to
Of
my
course,
panel
yeah,
members?
go for it.
So one thing that we struggle with that I don't know the answer to, so I want to ask smart people, is in our space, there's a very big challenge, especially because it's healthcare and some of us are clinicians, of being a researcher that produces and informs policy and being an advocate for good policy. And I've kind of pulled myself back, and when people ask, like, why don't you advocate for things? I'm like, that's not my role, because if I advocate, then it puts into question these relationships that I've built. But is this a missed opportunity? Like, you know, I think as academics, some of my colleagues feel like advocates and some don't, and I'd love to hear your perspective on that line and when it's good to do what. I don't know. I'm like, it's something that's been running around my head for, you know, a couple months now.
So I've been studying the science advising process during COVID in Canada and the UK, and this has been a burning issue. And I've analyzed it in the context of larger work that I'm doing as a conflict of narratives. And there are different narratives about the science advisory process. Is it a quest for the truth that will then be communicated to government? Well, in the scientific narrative, you never actually get there. You never actually get to the truth, but it is a quest to which you are faithful and your colleagues are faithful along the way. Is it a venture? Do you divert yourself from the quest in order to partner with government and policymakers towards some specific policy objective? And you could see in the early stages of the pandemic, particularly in Britain where I've especially focused, this wrestling between the two quest and venture narratives. But that very wrestling fueled a third narrative within the scientific community, which I called the crusade, which is we actually know what the policy objectives should be. We're not partnering with governments who have a conflicting range of other incentives. We know. And so they became critical not only of government but of their own colleagues in science. And so there is this conflicting set of expectations, and we need a narrative, if you will, or a mechanism of some sort that reconciles this, so that at least the participants in the process have common expectations. This is where I started with my previous point, a common set of expectations of what they're about. And I would argue, although this would need to be hashed out amongst the participants, if you want to be an advocate, then be an advocate. Stay outside the process, because once you're in the process, you're going to have to be compromising. You're going to have to be synthesizing. You're going to have to be recognizing the importance of ordinary knowledge and common sense. So we all have our preferences, and we can choose to be advocates, or we can choose to be close participants in the policy process. We can't totally separate those roles, but we need to have clear as clear expectations as possible about what we're bringing to the process.
That's a great case.
Well, if I could add just something more, I think, particularly over the last, say, since the election of Trump to his first term and Brexit, both of which I view as an extraordinarily anti-intellectual movement, but coming from a vast number of voices who feel they haven't been heard or participated in the process. And so that I think there's a whole other dilemma to this thinking about things, that we as academics in the public policy arena have not yet got our head around a feeling that's now at least 30% of the population may be heading up, that expertise, however balanced, is part of the problem. It will never come around to understanding our point of view, and the quicker we can tear it down, the better for the way society will evolve. And that is a very, I believe, strongly held point of view across certainly the United States and much of Western Europe, and is modestly strong in Canada.
Thank you for that. And that was a great question. Thank you. I didn't have that question. No, that was great. I want to open it up. I'm aware we have 11 minutes left, so I want to open it up to the audience for the Q&A portion of the session. Yes, please. Yes. I think
I have
Margie,
the
my colleague, will bring.
microphone, so I will ask the first question. Yeah.
Margie, just after you, this gentleman. Okay.
Yes.
Yeah.
So I appreciate what you said, Professor Fallis and Professor Tadrous, about how there isn't a lot of incentive for junior academics to really engage in the policy process, because, prior to tenure, you need to be prioritizing, in peer-reviewed articles and books and things like that. So I'm curious about your opinion on should there be a role of public scholarship in the tenure review process, like engaging in policy work or writing op-eds and things like that, to incentivize academics to engage in the policy process. If that makes sense.
Well, that's a question that has sort of been on my mind throughout my academic life. But I guess I've sort of gone back to old school right now, thinking much more that as you complete graduate school and take an academic position and come forward for tenure, the focus should be pretty clearly on however your discipline defines the leading scholarly literature. And that after that, one can begin to explore some breadth. Certainly, virtually all of my work, you could, although non-economists might not say so, economists would say it's public policy work rather than hard-nosed economics work. But I think you can explore within that context, but the first sort of real apprenticeship has to be in your discipline, unless your discipline is public policy, or, right? Then, of course, your writing can have that, but to me, it's only later that one should begin to enter into that. I think often we're, having not been trained in a very sophisticated way about the nature of the public policy process, except for people in these domains, we come across too often as simply experts offering without a kind of more subtle understanding of what generates effective public policy. And again, I think we as academics are, although we think we're not, I think very often are prisoner to our own particular paradigm and sense of the way the world has evolved. And I think that we have to be a little circumspect about our participation in public policy.
If I may, I think there's more that can be done on, if you will, the policy commissioning side as well as the university side in terms of the incentives for academics. And we focus more on the university. But it's been common in my experience, and George mentioned that this was pretty much routine at the Ontario Economic Council, that my contract would allow me to publish in an academic journal after some period of time. Typically, there was some embargo for the government to digest whatever I had done, but that I had the option to use the data to, and that's a real advantage for academics in dealing with the policy process, is access to data very often. But that I could use the data for an academic article subject to various requirements that, I not attribute sources or whatever. But that's actually quite common, that you can engage in the policy process and out of that get a publication. That may not be true for you, Mina, but for some of us anyway, that has been one way of dealing with these incentive issues.
This question is very top of mind because I'm pre-tenure, so this is just full disclosure, so I gotta watch what I say here. But I think for me, my North Star is that I am extremely grateful for being an academic. My background is that I'm an immigrant, and for me to have this role is like a very, very great, like to have the opportunity to ask questions and teach and do all the things that an academic gets to do. So my North Star is just like, I want to do it my way, in a way. But I'm also an immigrant, so I want to be practical and I want to keep my job. So so part of that is that I've learned to optimize, right? So I think about how can I meet these criteria but also still have that policy impact that I relish and I really want to do. And we've been able to find that balance, and some of the points have been raised by my colleagues about ensuring that we build in that process. We're very lucky in the sense that we are able to publish a lot of those questions that we ask. So sometimes we have to wait, and sometimes we have to do things in a certain way to play nicely. So we're still able to do that. It does come with funding sometimes, and so that's also a beneficial thing. At the end of the day, if, in the words of Jerry Maguire, show me the money, right? So it's there's kind of like an opportunity to have that. The last thing I will kind of make a note is that I am not that smart. And so one thing I've learned is, it's like I wanted to be the academic. Like I always was like, I have a podcast. This is a plug. But one of the questions I love asking academics is like, where do you get your questions from? And I'm always jealous. Like people, it's interesting where they get their questions from. I've hacked the system. I get questions from people who, like, these policymakers are literally handing me questions all the time. It's like, I don't even have, like, sometimes I have too many questions and I'm like, maybe I should come up with one of my own, right? And so as an academic, you feel kind of like an imposter syndrome because there's really great questions that come from both other policymakers because they have the pulse of what's happening. And so it's a beautiful thing. So it's been, in that way, really good for my academic career as well.
Just while we're switching, I just want to reinforce that last point, that being presented with a question, a problem, or a puzzle is really, I'm a vegetarian, but red meat to an academic.
Kale. Kale to an academic. If left to our own devices, we tend to derive our puzzles from our own discipline. Mm-hmm. But to have new puzzles presented from a relevant perspective is really important for what we do. Sorry.
First of all, thank you very much for coming here. I am Milap, a Master of Global Affairs student here at Monk School. My question is about the public trust in academic institutions, academics, and the knowledge they produce and the knowledge they transfer to affect public policy. There is a distrust, and we saw that during pandemic, about the impact of globalization, free trade, and many other things. My question specifically is about the impact of the funds that academics and academic institutions receive to produce knowledge. Specifically, for example, in the case of economic papers, because I'm a consumer of economic papers, I know that some specific academics produce this specific knowledge, and the other ones that, and the other ones that. And when we look at the funders, we know that there are some specific industries, like financial institutions or some specific industries behind that. They fund those researchers. And the academics produce those knowledge, and they transfer to affect the public policy. My question is, how can that affect the public trust in academics and academic institutions? Just I say there's a book by Paul Krugman, a Nobel Prize winner, arguing with zombies. He argues that many academics right now, they are funded by many industries, and they produce a sophisticated statistical findings that this policy works, but in actuality it doesn't work. But I want to have your opinion about this, what kind of impact it has on public trust in academic institutions.
Well, you certainly raised a big, a big question. I think we have to make a distinction between scholarly publishing and that whole continuum from scholarship publishing to think tank publishing to op-ed pieces to forming this, helping to form the general societal view on matters. I think on the whole, within the domain in which they work, scholarly publishing is still something that we look to and society looks to, actually. I think if you look at who society takes its views, where it has its views, a lot of them I still believe are well informed by public policy analyses. I think a danger remains that academics become too much advocates through their work as opposed to objective public policy analysts. So,
actually, I believe that although the public opinion data certainly show a decline in trust in institutions over time and cross-nationally, trust in science has not declined nearly as much, and in fact certainly recovered during a period of the pandemic, and then began to decline again as the public became disenchanted with the policies that resulted. I believe that trust in science per se, we ought not to be too worried about yet. But your question goes directly to the heart of this exchange, because as scientists, as academics become involved in the policy process, they become involved with a set of, frankly, elite institutions. And in many ways, certainly civil service is an elite institution. There are high barriers to entry into into the leadership of many of these institutions. So then academics become part of a mistrusted process. And I think that the critical issue is how we work on trust in that broader sense, broader set of institutions. Why has it become politically effective for certain political leaders to kind of trigger an underlying distrust in institutions? And I think that's what we're seeing. This is a topic for another panel. but there are different inclinations within the population, and there's been this wave of populist politicians who have found it in their interest to trigger distrust and to trigger anger. As I said in a recent discussion, it's a supply problem. It's not a demand problem. We have to figure out what is supplying this set of politicians.
So I take a more kind of very pragmatic approach on this, because in my kind of work, the elephant in the room is the pharmaceutical industry, and it's a massive force. It's one of the largest. There's a lot of money, and so what we find is that in the academic world, there's some colleagues who do a lot of consulting for them, and so they produce this kind of evidence. And so I personally don't take any money, although I probably should so I can afford a house in Toronto, but I don't. And the reason for that is that I wouldn't be able to have those conversations I would be conflicted out of sitting at the tables with the ministry, with Health Canada, with CADIT. I wouldn't be able to do those kinds of things if I took on those kinds of funds. With that being said, I approach this pragmatically, because on the other hand, and you raised this point about the other types of knowledge that's out there, I have some colleagues who will not even step in a room with the pharmaceutical industry. And yet, with some problems, they have an expertise and a deep understanding of their products that you need to know. And I'll paint the picture for you. So right now, I'm working on a project to develop a national at-risk medicine list. This is part of a process to help solve the drug shortage issue that's growing in Canada. If I didn't talk to the pharmaceutical companies about how they produce their drugs, the supply chain issues they deal with, and I didn't develop an expert panel that had many of them sitting around the table with the correct governance, I would have not learned a tremendous amount that's fed right into the models that we're building. But if I let them tell me what drugs to put on the list, that list would not be trustworthy. So you have to find that balance, and that's the approach I take with my policy work, because if I go to the government, and because they're talking to those companies as well, and they say, well, I heard you didn't even talk to them. Like, how did you ignore these facts? And there have been things that have made my work better, but at the same time, I know that it would compromise some of the work that I do. So I take that approach of trying to find that correct balance.
Thank you for that. I just want to be respectful of our panelists' time, because I know that we've gone over by 4 minutes. And I know that lunch is coming up right now. Okay, so, and I respect all your questions, and I've seen other hands go up, but I would appreciate if we can, end the session, and if you had questions, please feel free to approach our panelists if they continue to stay here. But I want to say, this was such an engaging session, and I'm so grateful for all of you, and I'm pretty sure the audience also enjoyed, so please join me in giving a round of applause for our panelists. Thank you for your time. Thank you. Really appreciate it. Thank you.